Alright, so I have the Ober's test. It's in a test for see if you have a tight. Alright, so I have the Ober's test. It's in a test for see if you have a tight IT band or TFL. So what you're gonna do is you're gonna have the patient in prone and then have the sideline. So depending on, we'll do that way. Yeah. So you want to have the testing leg up on top. Come a little closer towards me. So you want to make sure you can like on your side. Yeah. Get them comfortable. You want to have both their legs extended to start off. So since we're testing the left leg, you want to have them AB duck. You're gonna extend just a little bit. Extend, and then you want to flex their knee. What you want to do is you want to have the weight of the leg go down. If it's negative, if it literally just goes down and touches the plinth. You don't want to like let it drop immediately, but you do want to slowly let it go down. You stabilize here so they don't move. So his would be a negative test. If it was a positive, it would, since this would be really tight, you would see it like spring back up or just kind of hang in midair. So try to hold it here. So this would be a positive test. But since, now go ahead and relax. Since it's able to lower down, it means it's a negative test. So just things.
Okay guys, I have the Craig's test, and the purpose of this test is to test for femoral anteversion. Okay, so you want your patient laying prone. And then what you want to do, you want to possibly flex the knee to 90 and palpate for the greater trochanter. And then you want to possibly go internal and externally rotate until the greater trochanter is at its most lateral point. So for Heather, it's about right here. And then you tell the patient to hold this position. So hold it. You take your goni. You want the stationary arm perpendicular to the mat, and then the movable arm lined up with the tibial. Okay, and for Heather, she has 7 degrees. So if it's less than 8, it's retroversion, meaning you have duck feet. So your toes are pointing outwards. If it's greater than 15, you have toeing in, kind of like pigeon toe. And if it's between 8 and 15, it's normal.
I'll be showing y'all how to do the Ellie's test. So you're gonna start and you're gonna have your patient lay prone. Go ahead and lay prone for me. This is testing for tight rectus femoris muscle. So what you're gonna do is you want them to be close to you. So come a little bit closer to me. And here, let me start this side. It didn't say specifically that you had to do it on the opposite side, but this is just the way the book shows us. So I'm gonna show you both ways. Okay, so you want to put your hand here, you want to palpate right at the SI joint, and then you're going to flex their knee, push it in. If you feel their hip come up, then that's a positive test for a tight rectus femoris.
This is called the Patrick or Favor test. So you're gonna have the patient on supine. Go ahead and lay supine. So Favor, it stands for flexion, abduction, and external rotation. So you're gonna have the patient do that. So let's go into flexion, and then external rotation and abduction. So once they do that, you're gonna passively bring the hip or the leg down, and you can stabilize the contralateral. And the purpose of this test is to reproduce pain at the site that you're testing on. And also, so that's gonna be a positive finding if the patients are having pain here. And also, another sign is that the hip is not gonna go all the way down at the level of the other knee. All right, so what a positive is, it's gonna indicate that she has a tight iliopsoas muscle, or if there's any pain, it's gonna indicate any other hip abnormality or sacroiliac abnormality.
All right, my name is Marissa Michelle. I'm a student PTA, so I have the 90-90 straight leg test today. So you're gonna have the patient lay supine, and you're gonna have them flex their hip to 90, both of them, and then she's gonna grab behind her legs just to stabilize, and then she's gonna extend one leg at a time, so like at the knee, sorry, yeah, and then bring it down, and then extend the other, okay? So if she has like about 20 degrees of flexion or more, then that's a positive test for hamstring tightness.
It's not really a test, it's more of a observation. So you're gonna stand behind the patient, and turn to this, face the whiteboard. Yeah, okay, good. So you're gonna have the patient put their hands on their hips. This also kind of helps you see if there's any change, if one finger's higher than the other. So I'm gonna have you stand on one leg with your knee bent. Yep, good. And if you can see if this hip drops to the side, that would mean that her abductors are weak. So that would be a positive sign. If she also were to lean towards her standing leg like that, that would be considered compensated.